My name is Professor Colin Fleming. I'm Operational Medical Director here in NHS Tayside. My role here is to try and help everybody else with this response to this new situation which we're facing. So what we really want to do is build on the things that we really do well here in NHS Tayside. We know that we're an absolute centre of excellence in the UK in terms of bringing people into hospital, looking after them really well, really quickly, and getting them safely home again. We've got something like 14 or 15,000 staff in NHS Tayside, plus we've got the resources of the university and lots of other partners who are helping us. So we're really just trying to build on all that excellence that we have. What we really need to do with COVID is we need to build a hospital within a hospital, and I'm pleased to say that by this time next week we will have done that. We will have built a COVID hospital within Ninewells Hospital. We're incredibly lucky because our structure naturally in the hospital divides into an east wing and a west wing, and what we'll be doing on the west wing is all our normal business as usual. Now we'll be doing less business as usual because some of our normal services, things that we need to postpone for the next few months, well, those things can wait and we'll do less of that work. But actually what we are going to do is carry on all the normal work that we do. We'll be doing our cancer work, our non-COVID emergency work, and we'll be looking after people who are struggling with really bad symptoms from the disease. But we won't be doing everything. We'll need to make priorities round about that. On the other side of the hospital, we're going to have our new COVID hospital. Now think about this. The Chinese were lauded, they were praised for building a 1,000-bed hospital in a week for an enormous population. For our population in Tayside, we've built a 280-bed hospital almost overnight. We will have created this within days. It's absolutely astonishing what the staff of this organisation have done. Absolutely astonishing. So we need to try and use our staff some of the time differently, but some of the time doing what they normally do. If we do need people to do different jobs, things that they're not used to, then we've got a set of training and education up and running already. In fact, our first classes started yesterday, and we'll be running them day in, day out for as long as it's required. But mostly what we really need to do with staff is care for them. What we've learned, and we have this enormous advantage in that we're not the first people in the world to have this. The modern globalized world has presented us with this problem, but it's also presented us with a huge number of answers. So for example, we know that in the SARS epidemic in Southeast Asia a decade ago, what really helped everybody there was looking after the workforce really well. So this is first and foremost in our considerations. We just need to think, how can we look after people as well as possible? So we will be looking after each other.